Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Complications of Group A Streptococcus. The main complications of Group A Streptococcus includes puerperal sepsis. In puerperal sepsis is infection of the uterus and myometrium after the delivery is seen. So this is most commonly caused by Streptococcus. Streptococcus can also cause toxic shock syndrome. Toxic shock syndrome. Toxic shock syndrome can be caused by two organisms, Staphylococcus and Streptococcus. Among this Streptococcus can cause bacteremia in Streptococcus is more common when compared to Staphylococcus in toxic shock syndrome. Then we have streptococcal myositis. In streptococcal myositis is muscle infection of the muscle is streptococcal myositis. Actually, streptococcus can cause myositis, but the most common cause of myositis is Staphylococcus. Staphylococcus is the most common cause of myositis. Streptococcus can also cause pneumonia, especially community acquired pneumonia can be caused by Streptococcus. Empyema is infection in the pleural space. Infection in the pleural space can also be caused by Streptococcus. Streptococcus causes otitis media also. Quinsy, even Ludwig's angina, meningitis and pneumonia, all these can be caused by group A beta hemolytic streptococci.
thank you and thank you for watching.